Good evening and welcome to the Southfield Public Schools Return to School Plan. We're here tonight. We're grateful for all of our stakeholders, our parents, students, educators, board members, community partners, and all who've come on to be with us tonight and hear from our superintendent, Dr. Green. On tonight, we're going to utilize our Power Hour format, and we'll hear from Dr. Green. Your moderator for tonight will be none other than Erin Marshall, Student Support Coordinator and Retention Specialist. So with no further ado, we're going to put it in the hands of our superintendent and turn it over to Dr. Green.
Good evening. Thank you, Mr. Beebe. Thank you, Mr. Marshall, for moderating, and thank you to our parents and all other stakeholders assembled this evening. We're going to go through the return to school plan, sharing some of what we shared with our Board of Education on Tuesday evening. We've taken out some pieces and we've added some updated information relative to the most recent confirmed COVID cases here in Oakland County. And then we will afford you, our stakeholders, an opportunity to ask questions. If you have questions, we ask that you put it in the Q&A section of the website, and Mr. Marshall will combine like questions to ask of not only me, but the panel as well. We will have other experts joining me when the time permits. We will take questions after the entire presentation, and I will try to go through this in a timely manner to afford you, our stakeholders, an opportunity to ask as many questions as you need. So if you would, Ms. Corbett, please move to the first slide. We began formulating plans as early as March when we first exited school with the continuity of learning plan, and then that evolved into that of the return to learn plan. We had approximately 44 members on the auxiliary task force, and of course we had input from numerous focus groups as well as you, our stakeholders, by way of survey. Next slide. We also had some other members that provided us very vital information. Those included Ascension Providence Hospital, the Southfield campus, who is one of our healthcare providers, the Balmer Group, who provided us with some of the necessary resources, the Department of Health and Human Services, our friends at Oakland Schools, Oakland County Health Department, of course, our very good friends and neighbors, the Southfield Police Department, Southfield Fire Department, and the United Way of Southeastern Michigan. Our commitment to you is for the health and safety of all of our students and staff. That remains our top priority. We reviewed the Center for Disease Control and Prevention guidelines, as well as the Michigan Safe Schools, Michigan 2021 Return to School Roadmap. It contained numerous recommendations, and also some that were required, some that were highly recommended, and then those that were just recommended throughout the various phases. And you will see that in a future slide when I begin to speak to it. But what's most important on this slide, in addition to your health and safety being our top priority, is that of the first day of class being Monday, August 31st, 2020. As I mentioned, we did have numerous stakeholder surveys come out to the community. And then at the top there in blue, you see that the initial executive order to suspend in-person instruction from our governor did take place on March 16th. While we called school, it was initially for 3 weeks, then it went to 4 weeks, and then it went through the duration of the academic school year, which for school districts is that of June 30th, 2020. So beginning back on May 26th, we wanted to hear from you what you knew about the COVID-19, what your plans were for the fall, and how pleased were you with the continuity of learning plan that we had in our community. We also administered a staff survey to find out if indeed our staff members were comfortable using the online platform, if they found their students to be successful, and how comfortable they were with returning to the brick and mortar buildings, given that we all have a vested interest in our safety, health, and welfare. The second survey came to the families on June 29th. And you can see there were almost exactly 30 days in between the surveys. And then, of course, the staff had another survey on July 15th, and the parents had the last survey on July 23rd. When we administered the first survey in May, we found that many of our families did not know much about the COVID-19, nor did we. We are being completely transparent in that it was evolving at that time, and we were totally dependent on the healthcare professionals to guide us through the process. At that time, 43% of you wanted to return back to school. 17% stated that they wanted a virtual environment. A little over 37% stated that they were undecided, and a little less than 2% did not provide a response. We were across the board as well because we did not know what the lasting impacts of COVID would be. When we asked staff at that time, their greatest concern, 77%, stated that they were concerned with the spread of COVID, the school protocol to ensure safety and health, social emotional issues, and that of social distancing. Next slide. Our team began to plan immediately. We started with your stakeholder feedback, and then of course we looked into the research. We believe that every decision we make should be data driven and led by the science and best practices. So we looked at numerous white papers, scholarly articles. We looked at research and scientifically proven best practices. In addition, we attended numerous local, county, state, and federal educational, medical, fiscal, and legal forums and webinars. Lastly, we had numerous documents from the Michigan Department of Education, and then on June 30th, we received the governor's Michigan Safe Start Plan and the Michigan Safe Schools Roadmap to return to school. Next slide. These are some of the requirements, as I spoke of earlier, relative to the various phases. The region, Michigan, is divided into numerous regions. I believe there are 8. In addition to the regions, there are several phases in the return to work plan, which now correlate to that of the return to school plan. So in phases 1 through 3, there are certain requirements that you have to have for personal protective equipment in phase 4, in phase 5, and in phase 6, phase 6 being the least restrictive. All of these are required components that we would have to have in place if indeed we were in phase 4 and did in-person hybrid instruction, or if we went to a virtual platform. As you can see in phases 1 through 3, no PPE would be required due to the building being closed. You can also see on the far right that if we were in phase 6, safety protocols would no longer be required. Unfortunately, as I share the numbers later and the ones that just came in today, it does not look like phase 6 is in our very near future. Next slide. For hygiene, again, that first column is blank because that is the virtual environment, and we hope that all would practice the safe hygiene protocols at home. The in-school protocol, phase 4, 5, and 6 are listed there, which of course would be limiting the use of classroom materials to small groups, disinfecting between use, and providing adequate supplies to a very limited number of students. It would be a limiting of the sharing of personal items, and it would also restrict our students from utilizing their lockers. Those are just some of the items that are required in phase 4. And of course, you can see as you move into phase 5 and phase 6, they begin to lessen, ultimately leading back to where we were in January of this year. Next slide. Lastly, and this probably has the greatest impact for many of our families and many of our students, is that of spacing, movement, and access. It would not allow, in phase 4, it would not allow family members or other guests to come into the school except under extenuating circumstances as determined by district and school officials. It would prohibit indoor assemblies. It would stagger school schedules. It would mandate that we keep students and staff as far apart as possible. We would have to place floor tape throughout the building, and we would have to cohort the children as much as possible. What does that mean, Dr. Green? That means that your children would only be able to engage with a small amount of children, and it would have to be that same small amount of children each and every day as they matriculate throughout their instructional lessons. As we move into phase 5 and then of course phase 6, you see that safety protocols are no longer required, and that is where we all desire to be. However, right now, and we will talk about where we are as a region in the future slides. Next slide. As we were planning, we wanted to once again see what you were thinking 1 month after our initial survey. So we asked you again in June to provide some feedback relative to how interested you were in attending school in a virtual capacity, or how interested you were in your student attending a hybrid or virtual and brick and mortar capacity. You can see from the slides that 67, almost 68% were most interested or interested in that of a virtual platform. And I can't see those bottom numbers, but I know that I think it's 56% were interested or most interested in that of a hybrid platform. So we still were working very diligently to meet the request of all of our stakeholders. Perhaps you saw the news story where I mentioned we had at that time 12 different plans in the works to bring back our children to the brick and mortar, because we recognize that there is no instruction like face-to-face instruction with a highly qualified teacher engaging with our students. That is what our ultimate goal is. And by all means, this was the most difficult decision that I have had to make in my 25-year career. Next slide. In which phase is Southfield Public Schools? Well, as you know, Southfield Public Schools covers the city of Southfield as well as Lathrop Village. There are approximately 4 zip codes in Southfield and Lathrop Village: 48033, 48034, 48075, and 48076. That will be important for you to know as we get to a future slide. Next slide, please. As of yesterday, and these numbers have increased as afternoon, but as of yesterday, there were 80,172 confirmed COVID cases in the state of Michigan. Of that, 6,172 were confirmed deaths. And I use the term confirmed because there are numerous other cases that have yet to be confirmed. It says here that there are 57,502 that were or totally recovered. I challenged the term total recovery because we are now learning of lasting health implications relative to those that have been exposed to COVID. And this was documented as of July 24th. They only update the recovered cases once per week. So we do anticipate having those numbers updated on tomorrow. And you can see our sources there that we follow. We follow Michigan.gov coronavirus. We also follow Oakland Schools. I'm sorry, not Oakland Schools, Oakland County government and their coronavirus dashboard as well. It's also important to note on the far right, if you look at the different regions, those represent counties throughout Michigan. The very dark navy blue is that of Wayne County, and you can see that they have the most cases with over 14,111. It's important to note that while they may have the most cases, per capita, they are not the highest by far. So if you look to the northwest of Wayne County, you can see that is Oakland County, and it is just one shade less of that of Wayne County. So we're just slightly behind them. However, those numbers are in question as well. Move forward. So this is part of the Michigan Safe Start phases and risk levels. The risk levels go from 6 being post-pandemic, which perfectly align with the other slide that we showed representing phase 6 being when we could return to school as we knew it prior to COVID. 1 being uncontrolled growth. If you look at the map on the left, you see that the Grand Rapids area is in the persistent spread phase. And if you look at the area north of Grand Rapids, you see that that is the Traverse City area, and they are in yellow, which signifies improving. Well, if you look down where you see Detroit, and again, as we saw on the previous slide, Oakland County is just northwest of Detroit and Wayne County. One might think that that is orange, which means flattening, or yellow, which means improving, but I would challenge that color to be somewhere in between orange and yellow, meaning that we are approximately in the 3.5 range, because Traverse City obviously is yellow, and that is significantly different than that of our area. Also, given the governor's new executive orders that came out yesterday, that also gives me an indication that we are not in the improving phase any longer. Next slide. This is as of yesterday. There are 11,125 total cases in Oakland County. It's important to note, and Ms. Corbett, as you're controlling this presentation, if you could draw a circle around the cases by age group, particularly that of the 0 to 19. It's important to know that there are 615 confirmed cases in Oakland County of individuals between the age of 0 and 19. That was as of yesterday. This has since been updated this afternoon. They come out approximately 3 or 4 p.m. every day, and we do monitor it each day. It's also important to note that that next band shows the age group of 20 to 29, which as of yesterday had 1,389 cases. And we as a district do serve students up to the age of 26. So we do have some students that we are concerned with that fall into that age band as well. The next slide, I'll talk about the percentages and what caused me the greatest concern. The next two slides, actually, what caused me the greatest concern and ultimately led to the recommendation for the Board of Education. Oakland County statistics, this was as of Tuesday when I presented to the board. We had approximately 10,862 confirmed cases with another 3,249 probable cases. And then you can see the deaths there as well. If you add the confirmed cases with the probable cases, on Tuesday, we had exactly 14,111. So Ms. Corbett, if you could flip back to the screen with the blue map. One more. Right there. So if you look at the 14,111, that is exactly the break point for the next phase, or what is considered the most critical county in our state, that being Wayne County. So if you added Oakland County's confirmed cases with probable cases, then that we too would be put into that area that is at the highest risk in the state of Michigan. It's also important to note that we recognize there are numerous individuals walking around that are asymptomatic that have yet to be tested, but they can pass along the virus to someone else. So that's why we wanted to highlight the number of confirmed cases plus probable cases. Moving forward, you will see a table come up, I believe next. This is what was most alarming and what was the final indicator for us to make the decision to recommend to the board the remote start. Monitoring this daily, going back 2 weeks, on July 14th, there were approximately 292 cases in Oakland County under the age of 19, which was 3% of the overall total. As you can see, 2 weeks later, which was the 28th, we were at 5.3%, or the equivalent of 576 cases. As of today, this is the updated slide, there are 646 young people in Oakland County that have tested positive, or the equivalent of 5.7%. If we continue with this trajectory with exactly 4 weeks until school begins, we will be well over 10% of the population in Oakland County having tested positive, being under the age of 19, which of course is the majority of the students in which we serve. Also, you'll see the note at the bottom that approximately 12.5% of those having tested positive in Oakland County are between the age group of 20 and 29. And as I mentioned before, we do serve students up through the age of 26. So that too is alarming for us as it pertains to our students' health, safety, and well-being. Next slide, please. Again, you heard me mention the zip codes in Oakland County and the ones in which we serve as a school district, and these are listed in order of cases throughout Oakland County. The first 4 on the list, which of course are the 4 highest in all of Oakland County, belong to the 4 zip codes that we serve: 48033, 48075, 48076, and 48034. This is why we made the decision to make the recommendation that we did. And while we know that everyone is not pleased with this recommendation, and we don't have all the answers as we sit here today, and we will have numerous ongoing parent forums for you to continue to ask questions, these are the factors or the indicators and data points that led to our recommendation. Next slide. So Southfield Public Schools, as I mentioned, between phase 3 and 4. And if you recall, going all the way back to the beginning, if you would please, Ms. Anika, to the governor's roadmap where we had phases 1 through 3 in one category and 4, 5, and 6 side by side. One more. Keep going. Back to the beginning where we had them at the top. There. Thank you. So as you can see there, oh, right there. Thank you. As you can see there, phases 1 through 3, the governor's roadmap does outline that we go to virtual instruction only, and phase 4 would be that of virtual instruction. And if you did in-person instruction, it would be with the required safety protocols for a hybrid model. Given that we cannot clearly identify if we're in phase 3 or 4, and the numbers are rising at such a steady rate, we are erring on the side of caution with the recommendation to begin in a virtual remote instruction only platform for the beginning of the school year. You can fast forward, Ms. Corbett, all the way back to after the slide or after the table. Thank you. Also important to note, between March 1st, 2020 and June 30th, 2020, the Southfield Fire Department and paramedics responded to 3,898 calls. Of those calls, 2,044 were COVID-19 related. Next slide. So what is our return to learn plan? Our return to learn is that we are committed to serving the whole child. As decisions are being made and systems being developed, we want to first and foremost keep our children safe, healthy, engaged, supported, and challenged. And we do believe that we can do that from a remote platform, at least for the beginning of the school year, until we can guarantee their safety. Many have expressed concern with wanting to come back to the brick and mortar. And as I've indicated to those individuals, if we can't guarantee the health and safety of all, we cannot put one at risk. Next slide. Our July surveys, you can see the stark shift from our stakeholders to the left. Our external stakeholders or our parents indicated that they were less interested in returning back to the hybrid or face-to-face. Approximately 61% was interested in that of virtual, where a little less than 40% was interested in hybrid, remote to hybrid, or face-to-face. So what does that mean, remote to hybrid? That means that once the health conditions call for a safe return, we will gradually bring those children back to the building. Others, the 61%, indicate that they wish to remain virtual or online for the entire academic school year. To the right, you see our internal stakeholders, our teachers, our principals, our secretaries, paraprofessionals, and even some of our board members that serve in dual roles. Our board members too have children and grandchildren in the district. So the decisions that they make, they do not take lightly, and we're grateful for their support relative to this recommendation. So based on the review of the SPS K-12 hybrid and full virtual models, we asked what plan did they feel was best for our students. You see here that a little less than 69% indicated that full virtual would be best, and a little less than 30 or a little more than 32% indicated that they felt hybrid at the time would be best. Next slide. So in light of the multiple variables, unanswered questions, increased number of confirmed positive cases, and the safety of all stakeholders, the superintendent recommended to the Southfield Board of Education, and it was unanimously approved on Tuesday, that we begin the 2020-2021 school year with 100% online or remote instruction until the COVID-19 data and conditions are contained, which would be phase 5. We also recommended that we conduct monthly evaluations. We don't want to see our children out of school for the entire year. We want them to come back as quickly as the conditions call for. So we would make a recommendation to the Board of Education either to continue with online or remote learning or to phase in the hybrid model by the 4th Tuesday of every month, which for our board is their monthly study session. We also asked that we transition from the online or remote platform to that of the hybrid instruction in a gradual process, that we introduced our students back into our building with phases being that of our youngest learners coming first and that of our special populations returning first, and then gradually building to all of our children returning back to the brick and mortar platform that choose to come back to the brick and mortar platform. Again, the virtual platform will be available to all of our stakeholders for the duration of the school year if that is what the family decides. Next slide. So what did we take into account as we thought about these decisions? Of course, you've just heard a lot of data, a lot of numbers that came from the local level, the county level, as well as the state level. We took in account the safety, health, and welfare of all stakeholders, not just that of our students and families, but that of our teaching staff. They too are part of the Southfield Public Schools family, and we're concerned about their health as well. We're concerned about the social, emotional, and mental health supports that would be necessary for our staff, students, and families. We looked at the condition of our facilities. One of the recommendations calls for the social distancing and how many students would that allow us to have in a classroom at any given time. It was less than 15. In most cases, it was 12, which would require us to hire twice the amount of staff that we currently have. And I'm not sure if many of you are aware, there's already a teacher shortage, not only throughout the state of Michigan, but throughout the country. So that would have been virtually impossible to have all children taught by a highly qualified and certified teacher. It would have required us to bring on substitutes. And we know that we all want our child to be taught by a highly qualified, certified teacher. Therefore, the remote platform would provide us an opportunity to do that. We looked at the importance of student interaction and socialization. We looked at the need, again, for increased instructional and support staff. We looked at various instructional needs and delivery models. We looked at the limitations of the physical space and the current bus fleet. We would only be afforded an opportunity to allow one class to go outside on the playground at a time, and the playground equipment would have to be cleaned and sanitized between each group. Even if we had the funding to cover the additional requirements on the bus fleet, there aren't enough buses having been mass produced. Therefore, bus fleets across the entire country are being challenged right now. We would essentially, as a district, have to double, if not quadruple, our bus fleet here in Southfield, because we would have to have one student per seat, skipping every other row. We have the limited availability of we have been fortunate to garner support from some individuals to have masks and other supplies, but there are other things that we've not been able to get. I mentioned on Tuesday that the sanitizing wipes are now in high demand and in very short supply, similar to that of the toilet paper and paper towel a couple months ago. And what, again, really pushed us over the edge with our decision was the rise in COVID-19 cases in Oakland County, particularly that of young people between the ages of birth and 19. We consider the need for accurate student achievement data. We want to know that our children are being successful, even if they are not learning in a face-to-face environment. So we talked about some various assessment centers being established. And then, of course, we looked at isolation centers. What if we suspected a staff member or a student having come in contact with someone that might be COVID positive, or if we suspect that individual might be positive themselves? In the case of the bus situation in the morning, as a district, we would not be able to put the child on the bus to ride to school or return back home, not knowing if a parent was there to receive the child. Unfortunately, we would have to have a secondary plan in place by which another bus or van drove around the district to pick up children that we thought may be infected. Now, as we all know, the flu season is rapidly upon us. So if we have one with the flu and one with a common cold and one suspected of COVID, and we're not medical doctors, and we put them all in a centralized location, we may be the cause of them being infected, not knowing if the child is COVID positive or not. How many can go into an isolation center? What is the duration of their time in that center? Even after we clean that center, you can't have another child to go in for another 24 hours. So there are a lot of logistical pieces that had to be taken into account as well during our conversations. The good news is we have been assigned 3 medical nurses, 3 registered nurses through Oakland County at no cost to the district through our interagency agreement with Oakland Schools and Oakland County Health Department. We will have them on site working with us as we build out these policies for a safe and healthy return for our students and our staff whenever that time may be. Next slide. Some families of students that have IEPs or 504s or family support plans may be wondering, how are we going to administer FAPE, which is free and appropriate education for students with additional needs? Our Intense Student Support Network is committed to demonstrating good faith effort in providing virtual learning programs for all of those students. We plan to provide early intervention and early on intervention and processing any new referrals that come from Oakland County. We will continue to provide social work, occupational therapy, physical therapy, speech and language services, and our special education teachers will work in concert with Oakland County, Oakland Schools consultants to ensure that all of our children are getting what they need throughout this process. Next slide. And the teams, specifically that of the Intense Student Support Network, will develop the 2021 distance learning plans in collaboration with the parents. It will not be done in isolation, and the PAC, which is the parent governing body, to determine the instructional and ancillary support services required for family success. And that's important to note, family success. We recognize that this is a new environment for parents and grandparents where the child is learning at home and the parent or grandparent is not necessarily trained as an educator. So we are willing to and positioned to provide professional learning for families. We are prepared to provide supports on off hours, in the evenings, on the weekends, to accommodate the needs of the families. We're also positioned to provide virtual toolkits to be distributed to students with complex needs, and then learning packets to accompany the virtual instruction to support reinforcement and individualized support. We want the children to have opportunities for hands-on learning while they're in the comfort and safety of their own home. And they will be doing those hands-on experiences with the teacher and their classmates by way of the remote device that will be provided by the district. Next slide. Healthcare partners, we are still very much committed to the physical, mental, and emotional health of all of our children. We still have a very strong relationship with Instructional. They provide support to all of the schools. CNS Healthcare Mobile Services, they provide services for University and MacArthur. And of course, you heard me mention Ascension Michigan School-Based Health Center. We are in the process of breaking ground for a full health center there at Southfield A&T, which will service all of the children in our community. But in the interim, we do have means by which to access Ascension services. And there at the bottom, you see Mr. Allen's information if you need to get in touch with him prior to us completing that facility. Next slide. Instructional materials and learning. We are committed to providing each student with a Chromebook. In the spring, when we went to the emergency shutdown, we provided 1 device for every 2 children in the household. We are working with our business leaders to purchase more devices to ensure that every student would have their own Chromebook as we move forward with the beginning of this school year, recognizing that one child may be in grade 2, one may be in grade 6, and one may be in grade 10, and they all need to be online at the same time learning something different. We want them to have that. Where applicable, we are going to provide internet connectivity assistance. I was on with Oakland Schools prior to this meeting, and we talked about how Oakland Schools can support us with increasing the connectivity throughout all of Oakland County. We do have a few hotspots remaining, and of course we work with our local internet providers to provide you with the best rates possible throughout this time. We, through the consideration of our Board of Education, now have a single sign-on access for student users. What that means is you no longer have to memorize the username and password for every different software or virtual platform that we have. You can log on to one system and all of those applications will be there for you. Similar to those that have the iPhone, and I don't know what it's called on the Android, so forgive me because I don't have the Android, but you download the apps and the apps are all there in one location for you. We are also committed to providing a back to school list for virtual learning by grade and by program. We are going to ensure that all staff have the appropriate instructional materials, be it hardware, software, or web-based access. Each staff member will have a headset with microphones to ensure that you can properly hear them. We will continuously provide professional learning for all staff. It will be housed in a virtual format so that any staff member can go back and watch them as needed. And then, of course, we will have workshops, video, and live demonstrations to support our students with best practices, helping them to learn how to learn in a virtual environment because it is different and we recognize that and take that into account. We will also have ongoing and varied supports for parents, students, and staff, inclusive of the creation of our learning management system. And we will have a ticket help desk for you to always have access to someone in the event that you get stuck in the process. Next slide. Attendance and participation. I heard a lot of this from the continuity of learning plan. It's important to know that the fall 2020 online instruction will be more rigorous than the spring continuity of learning plans with more accountability in place. So what does that mean? Attendance will be taken daily. Grades will be earned. Again, it's important to note grades will be earned and standard report cards will be issued. Students will be required to submit a minimum number of weekly assignments. I know one of the questions will be, what's that minimum number? We've not yet decided, but we must have a minimum number of submissions in order for the courses to count with the Michigan Department of Education. We have to have evidence of not only attendance by way of two-way communication, but we must have evidence of forward progress, meaning that the students are learning and are turning in assignments. There will be 5 days of instruction provided each week. We will follow the district calendar. Therefore, if we are off for the Thanksgiving break and or the midwinter break, of course, there will not be classes offered during that time. Also important to note, our classes will be taught by Southfield Public Schools staff using the Southfield Public Schools board approved curriculum. Next slide. For those families that have voiced concern relative to their inability to provide instruction to their child or oversight, because the instruction will be provided by the teacher, the families will be providing oversight. We did partner with Champions. They've been our partner for some time. They were providing before and after care for our children. Now they have agreed to move into that of providing services throughout the entire day for those families in need. There are licensing requirements by the state of Michigan, and we're fortunate to know that Bernie K-8 school have already met the requirements, given that they have held programs in that building in the past. So Champions will use the Bernie location throughout the virtual start of the school year. When the district returns to the in-person or hybrid model, Champions will provide the service at Eisenhower Elementary. That will afford both Champions and the district ample time to acquire the necessary licensing for that particular building. And lastly, everyone wants to know, how much will this cost? The fees will be dependent upon the number of participants in the program. We are all working diligently to keep the fees to a minimum. However, they are responsible for staffing the program and for providing the necessary supports. Therefore, there is a charge. We are looking at scholarship opportunities by way of our partners, and we have someone reaching out to the Michigan Department of Health and Human Services to see what type of support they can provide to offset some of those costs as well. But from what I've been told by my staff, the costs that were being proposed that have not been solidified are still much lower than that of any other entity that are in our surrounding area as we speak. But we're still working to get those as low as possible for our families. And what would that mean for our families? That means that your child could go to Bernie if they were part of the Champions program with the Chromebook that the district provides as early as 6:30 a.m. And they would go through the entire day with their instruction and their class being monitored by an adult that has been approved by Champions and the Michigan Department or the Michigan licensing to provide oversight for your child. There will be time for lunch, there will be time for physical activity, and the Champion staff would be at that location until 6 p.m. So that is affording families 11.5 hours to go and do what it is they need to do. If it is to go to work or to care for one of their family members, we did want that option to be available because we are sensitive to the needs of our families. Now, some may ask, if we're able to bring children back to Bernie for Champions, why can't we just open school? Well, the restrictions are such that even with Champions, they will be able to provide the social distancing. The number of adults to students would be less, and they would have the PPE. The other requirements, unfortunately, we are not able to meet at this time. And if we did not have a need with our families, we would not have children in the building with Champions. This is to meet the needs of our families because, as I indicated earlier, the numbers are rising, and we do not want to contribute to those numbers in any way, shape, or form. Next slide, please. This is a sample schedule of what Champions may have. Of course, from 6:30 to 7:30, they'd have students come in. They would do the wellness check, which is probably inclusive of that, of the temperature, to ensure that a child can come into the facility. They would have meetup, washing of hands. You see their transitions, distance learning classrooms, etc., dance, freeze, reading, teacher's choice, homework support. There are a plethora of activities that your child would engage in throughout the day, which affords some families the opportunity for that socialization. However, the student must be enrolled in the program. It's not a drop-in service. It is truly something that they would have to adhere to. And thank you, Catherine. Catherine said that that morning check-in would be temperature check and health screening questions. So she too is on the call, and she is our director of our Champions program. So thank you, Catherine. Next slide, which I believe is questions. So I've shared a lot in a very short time period because I wanted most of the time to be for our families to ask questions. So Mr. Marshall, at this time, if you would.
Thank you very much, Dr. Green. Can everybody hear me okay?
Yes.
Thank you very much. Okay, so I'm going to start at the top. A lot of these questions have already been answered through the slide. Some people were placing their questions as you were delivering the message. So I'm going to just go over them briefly with you. One, when will parents know if children have been taken off the waiting list to be accepted into school?
The waiting list to be accepted into a particular school or to school in general?
That's what I'm thinking. They weren't specific, but I'm thinking it's a particular school,
Okay.
and they've been waiting. Yes.
Right now, we shouldn't have any students in general waiting to be accepted into school. There are approximately 50 students having recently tested for University Middle School and University High School academies. I spoke with Dean Williams earlier today. Those exams have been shipped to California for scoring. We do not score those personally to remove any bias. We send them to California, and once we receive those results, we will notify those families. So if that's what they're inquiring about, as soon as we receive those results, we will share that. So that's usually within a week to 2 weeks, depending on how backed up they are in California, with California being a major hotspot right now with COVID.
Gotcha. Thank you. How will sports and electives play a role in remote learning?
Unfortunately, the governor's executive order yesterday threw a monkey wrench into what the Michigan High School Athletic Association shared for guidance. So we are constantly monitoring local, county, state, and federal guidance that comes down. And the Michigan High School Athletic Association shared that they were going to introduce fall sports and had certain protocols in place. Well, at the same time, the governor's executive order now indicates that you can have no more than 10 individuals indoors and no more than 100 individuals outdoors. That's a direct contradiction to that of our football practices, because most of our teams have a minimum of 40 on the football field. And if you take into account 2 teams playing in competition, plus the coaches and parents, you're well over 100. There are some football teams that have over 100 on their respective teams. So we're waiting for additional clarification relative to sports or relative to athletics as it pertains to extracurriculars such as art and dance and some things along those lines, band. We will still look to do those in a remote fashion. We are working very closely with our elective teachers to ensure that we are providing the absolute best. As I shared with some people earlier today, my only big concern relative to electives would be that of vocal, given that everyone sounds a bit distorted coming through the computer. And as we've most recently witnessed with some of our own devices, dependent upon the quality of your headset will alter your sound. So that may alter our choir. And as we know, we have an award-winning choir. So we're still working on those pieces, but we are looking to have as many opportunities for our students as possible.
Thank you very much. Children and students with IEPs, what special, they have special concerns about how they will learn remotely online and at home. What help do we have for them?
Thank you. So as I indicated on the ISSN slide, which is our Intense Student Support Network, they will be working, the team from Southfield Public Schools will be working very closely with the families to determine what additional supports are needed. And some of those supports will come by way of distance learning or remote learning. And there may be times when the individual would have to come in, be it for assessment. And we didn't include the slide for the parents on the assessment centers. We did at the board meeting on Tuesday. We are looking to have assessment centers set up throughout the district to ensure that if a student needs to come in for any specific testing, we would have that center available for them. So we, again, they're called individual because we really want to work with the families to ensure that every child has what they need and not something that's common to all students.
Thank you for that. They had a Chromebook question before the policy was one per 2 children, and some parents want to know, will it be 1 per child now that we're going to full remote learning, or how does that work?
Yes, I did speak to that, and we have 2 tentative dates set where we will distribute additional Chromebooks to those families, and of course they will be based on appointments so that we're not overrun by cars and or frustrating parents having them wait in line. So we will have scheduled probably by school and by alphabet for families to come and pick up those additional devices. Dr. Freeman is on the call, so I'm going to ask her to be elevated up to the panelist level for her to address the question relative to students with IEPs.
And while she's doing that, the tentative dates for the computer distribution is August 24th and August 27th as of now. Those are the tentative dates which will be shared with the entire district.
Thank you, sir.
No problem. Should I continue or should we wait on Dr. Freeman? I think I just see her.
Looks like she's popped up, so if she could unmute. If you're on by way of your phone, Dr. Freeman, try 6, that might work. Okay, while she's doing that, and again, forgive me for looking down. I'm constantly being updated by my team, who are absolutely amazing. So I have two phones and 3 laptops, and I'm constantly responding. So I just received a message from Nancy who said we will be scheduling an additional bridge book distribution date for next week because we've had families inquire. For those families who missed both dates and the additional makeup day, communication will be forthcoming. So we do have a few of those books left, and we are trying to accommodate everyone in that regard. And it looks like Dr. Freeman dropped off. You see her?
I do not anymore.
Okay. Well, when she comes back on, we'll double back. In the meantime, let's go to our next parent question.
Okay. Alrighty. Some questions were answered directly by Mr. Beebe privately to the parents.
Okay. Is it a question that's worth lifting for others, given that they may have that concern and they didn't think to ask at this time?
That's what I'm trying to read through. For the most part, you answered it actually a couple times, most of the questions.
Okay. Also, it's important to note that our best resource is going to be our district webpage. We have a separate link for our return to school plans, and we will constantly update that relative to new decisions. Again, the governor's executive orders continue to change. The positive cases in Oakland County continue to change. And as we receive the governor's executive orders, we have to adjust or pivot accordingly. So we're trying very diligently not to inconvenience the families any more than they have to be. For many of the families that indicated that they are having to return to work, I would question your employer as to if that is now applicable, given that the governor's executive order states that you can't have any more than 10 individuals indoors. I'm not telling you to call your job and tell them that you can't come to work because the governor said so or that Dr. Green said so, but I would inquire as to if the governor's executive order, which is 2020 160 and 161, how that applies to your own personal employment situation with remote work as outlined by the governor. Dr. Freeman, welcome aboard.
Thank you. Good evening, everyone. So I noticed that there were a few questions regarding students with IEPs, and just to reiterate what you've already said, that we are committed to providing that individualized support. The good thing is at the end of the year, most of our team members met with our parents to develop reintegration plans. These reintegration plans not only took a look at how did the virtual support go in the springtime, it also talked about developing next steps as we move back into the fall. Naturally, we had hoped that we would be back in our buildings, but now due to the increased risk, that data still will allow us to move forward and develop new distance learning plans in conjunction with our parents so that students will not only be provided individualized support, we'll talk about accommodations, we'll talk about a balanced approach, in addition to supplementary aids and services kits that will be provided so that those students can access the curriculum.
Thank you, Dr. Freeman. We are committed to providing every student within the Southfield Public Schools access to our curriculum. And then, of course, we will do any necessary accommodations or modifications as called for in the individual family service plan or the individual education plan.
Another question. Every grade level K through 12 will all be online virtual, correct? Just to clear up. Even the kindergartners was the question.
Yes, we will. Actually, our early childhood will have access to online platforms as well. So those that have been accepted into our Little Steps program or our Head Start program or our GSRP program, they will have kits to work on at home with their families. They too will have devices to work with their families in a remote setting. We also have our young adults program, and we will build out what that looks like for those students as well. So Southfield Public Schools is one of the few districts that actually serve young people from birth through age 26. Not many people know about that unless you have a child in that program. And we are committed to continuing to serve those individuals from birth to age 26. They're all our babies.
Thank you for that. A question asked a couple of times, when will this plan be reassessed? And I know you went over the phases with them according to the governor's executive order. But if you can touch on that again, because a few people asked, how often will this plan be reassessed?
We will assess the plan every 30 days. We're actually assessing the plan every day as we continue to add pieces to the plan or to minimize pieces that are no longer value added to the district. In terms of a formal recommendation to our governing body, which is that of our Board of Education, we are committed to making that recommendation to them by the 4th Tuesday of every month. So every 4 weeks in any given month. Also, it's important to note that Champions stated that they also offer 3 pre-K at Magnolia if any family needs them.
Thank you. I have a few questions here about how to apply for Champions. So a lot of people are interested in it and think it's a great idea. How do they apply?
Excellent. I'm guessing Catherine will chime in and share that information with us. Can you move her up on the panelists list? She's texting me, so either way she's communicating, but now she's up on the list. So if you take off your mic, Catherine, and share with our community. Catherine? Okay, can't hear her, but there is a discoverchampions.com is their website, and we will have the hyperlink on our webpage. So our families don't have to search for it. Again, all of our information will be on our district webpage. So it's best that you go to our district webpage, and we will put the hyperlink to Champions on our webpage so that you have easier access to that information.
Thank you. Let me see here. So someone said they are school of choice. If they pull their kid out of homeschool, will he lose his spot to reapply?
I'm not really understanding the question. Their school of choice, if they pull their child out to homeschool, if they pull their child out of the district to do their own homeschooling?
Correct.
My recommendation, okay, I'm not sure, but if that is what they're referencing, my recommendation would be to afford them an opportunity to stay in the district and do the homeschooling by way of our certified highly qualified teachers. And if they wish to add any additional layers to their child's experience at home, by all means, please do that. But you now have access to stay in our virtual program for the entire year, which would afford you an opportunity to keep your space in the district, to have access to our rigorous curriculum with our content experts, and have that homeschooling experience for your child.
Thank you. Do you have an answer for OTEC right now, for the high schoolers that attend OTEC?
I'm so glad that question came up. I was on a call with OTEC this afternoon. My day literally starts at 4 a.m. and I don't stop with calls until I usually pass out, but the babies are worth it. The OTEC is currently, again, this is the answer as of 7/27 on July 30th. OTEC is planning to have their doors open 5 days per week. There are some districts in Oakland County that have not been impacted by COVID the way in which the Southfield community has been impacted. Therefore, they will make OTEC available to our students. What does that mean? We're not running buses to OTEC. So if a family chooses and feels that it's safe for their student to attend OTEC classes on an OTEC campus, they have the ability to do that. I am working with OTEC as we speak. I indicated that I spoke with them earlier today to see if, while some may feel comfortable, others may not, if they can have a camera and have those lessons happening simultaneous with that live instruction on site, face to face at OTEC. I don't have the answer just yet, but we are working on that as well. Again, our objective is to ensure that our children have as many experiences as possible.
Thank you. How many hours a day will there be specific instruction going on virtually? Is it normal school hours? Is it condensed? How many hours per day?
We will provide guidance and frequently asked questions as to how much time students should have on screen, and then asynchronous. So we have synchronous instruction, we have asynchronous instruction, and then we have group activities that will occur where we're outlining the learning kits. So having said that, every child is entitled to 1,098 instructional hours throughout the year. Right now, we're looking at most of the instruction occurring between the standard school hours to keep them in that routine, but there will be some opportunities for families to engage in terms of asking questions. We may have some, I know our teachers are absolutely amazing. Some of them had office hours in the evenings, and or through the summer, even when the continuity of learning plans ended. So that will be on an individual basis, but for the most part, the bulk of the instruction will occur throughout the school day. The reason I say the bulk, the asynchronous instruction will be pre-recorded, it will be videos, and your child can have the option of looking at those at any time throughout the day because they will be readily available on demand.
Thank you. There's a question about the third grade reading law. How is that? Would that still be in effect with the virtual learning?
That is up to our legislative body. And as it currently stands, I believe they are looking to possibly suspend the read by grade 3 for another year. I do not have a definitive confirmation on that, but I know that there are numerous discussions relative to the standardized assessments as well as the read by grade 3 and some other things. It's also important to note that our Board of Education was very kind in approving our request to have the graduating class of 2021 adhere to the Michigan Merit curriculum graduation requirements and not the standard Southfield graduation requirements. Southfield has always gone above and beyond in terms of their graduation requirements. Given the devastation in our community, we are now going to adhere to the Michigan Merit curriculum, which is that of 18 credit hours and not the 24 that were required by Southfield prior to. So that gives our families a little more flexibility if indeed they were impacted by COVID. By no means do we want anyone to try to take a shortcut to getting their diploma, because to have a Southfield Public Schools diploma means something, and we want it to continue to have that value.
Thank you very much. And I'm glad you answered my next question was about the standardized testing, but you answered that. Okay. Next question here. And it's definitely 5 days a week, virtual, correct? Monday through Friday.
Absolutely. Absolutely. And we will follow our district calendar. So the district master calendar will be posted on our website. Again, our school year begins August 31st. And if the calendar indicates that we have 5 days of instruction, we will indeed be in class 5 days.
Okay. And I'm going to end with this question. And I want everybody to know, which I'm sure Dr. Green will touch on as well. The Student Support Network, BB and myself, we see every question that is asked, and we will definitely answer every question if it has not been answered already. Separately, we see who asked it, and we'll get to it after this meeting is over. Give us the next 48 hours. But the last question that I do want to lift is a popular question I see on here, and they're asking about when will class schedules be out for their students.
Well, given that this plan was just approved on Tuesday, we are working as fast as we can to get everything programmed into the system. We hope to have everything to you no later than the second week in August. And that's moving at warp speed. So we thank you for your patience in advance, and we thank you for allowing us to serve your child and your families, but we will get those to you as quickly as possible as we move through this process. And hopefully we have no more interruptions by way of executive order and or the pandemic spreading any more devastation throughout our community.
Thank you very much.
Mr. Marshall, you did mention the Student Support Network. That's something I take great pride in us having, given that we believe in servicing all families and all children. So we built in an additional layer of support prior to students needing intense student support network. And right now we have additional supports for our families that are in need of healthcare. You may be able to speak to whether or not we're back on board with Optimized for our students that need additional eye care.
You know what, at this time, they're still in transition through COVID, so we haven't heard back, but they're going to get back to me on a date that we'll be able to assist with the eye care, as well as we're getting lined back up with U of D Mercy in regards to dental. So we should have dates on that very shortly.
And we're also working on a platform with Ascension to provide an opportunity for our families to get caught up on their immunizations, because we recognize that several of our families did not go to their pediatricians throughout the time of COVID. So we want to make sure that we have something in place for our families to get caught up on relative to to their immunizations. Question just came across my desk. If parents help with virtual, we will have several parent learning opportunities where we will assist them. We will also have a help desk platform available for our families to receive ongoing support. You are not in this alone. We will be here with you throughout the entire process. Trust me, I often need help with the virtual platform, and I know who to call on for that. So I'll make sure that my resources are available to you as well. It's also important to note that we have 3 additional weeks of produce and dairy support to our community. We will be outside of Southfield A&T High School again on tomorrow, beginning at 9 a.m., going through 1 p.m. or until we run out of supplies. We generally give away between 1,200 and 2,400 cases of fresh produce and fresh dairy products each and every Friday. That grant goes through the next 3 weeks. It was extended once again, and we're working on some new grants for the future to help assist our families that are in need with food scarcity. So, did I forget anything, team?
I think we're set.
Think we have it all?
I don't think so. I don't think so.
Excellent. Again, I just want to thank the families for trusting us with the education of their children, knowing that we have their best interests at heart. Again, this was the most difficult decision that I've had to make in my 25-year career, and we don't take it lightly. But the health, safety, and well-being of our children, our families, and our staff is most important to us, and we will do whatever we can within our powers to ensure that we keep you safe and that we continue to provide you with high quality instruction. Thank you very much for your time this evening, and again, look for updates on our website. With that, have a good night.
Thank you all very much.
Thank you. Bye-bye.
Everyone have a great night. Take care.